My favorite writers is Lynn Parramore. Has just been doing brilliant writing for years, and at Lynn, Lynnparramore on Twitter. And she's got this new piece that was published over at the Institute for New Economic Thinking's website titled "Warning: COVID-Fueled Mental Health Crisis Will Be a Costly Second Pandemic." And I think this is a story that really deserves all of us paying some serious attention to it. So on the line with us is the aforementioned Lynn Parramore. Lynn, welcome back to the program. It's been a long time since you've been on. I'm glad to have you back.
I'm so glad to be here with you.
Thank you. Thank you. You write, COVID has now blown the lid off a crisis building for decades. And then you ask the question, so why isn't there a plan to deal with it? What is that crisis that has been building for decades, and why don't you think there is a plan?
Yes, well, we have had a lot of cases rising of anxiety, mental health disorders. That was building for a long time, but the pandemic has sort of shined a light on just how bad it was and has gotten. I mean, just to throw some startling numbers out at you, the Lancet has reported.
This is the British Medical Journal.
That's right. The very highly regarded British Medical Journal reports that we have 53 million new cases of major depressive disorder and 76 million new cases of anxiety disorders.
In the United States?
That is globally,
okay.
Since the pandemic has begun. We have better monitoring systems now. The pandemic has actually allowed us to collect data more effectively and efficiently than we have before. And in the United States, a data system that the National Center for Health Statistics put out with the Census Bureau found that about half of adults between 18 and 44 were having symptoms of anxiety and depression during the pandemic. And 38% of adults living with children were experiencing those symptoms. And that's particularly concerning because in families, there's sort of a feedback loop. If the parents are depressed and anxious, the children are more likely to be, and vice versa. You know, they sort of transmit these symptoms to each other. And we're definitely finding that younger adults have been particularly vulnerable during the pandemic, as you would expect, racial and ethnic minorities, essential workers, and unpaid caregivers. That is a category that is, particularly impacts women who've been hard hit with mental distress and increased substance abuse during the pandemic. And when I say there's no plan to deal with it, there's no plan to deal with it yet. There are some provisions in Build Back Better that would help, that would alleviate some of the burden of child care and give people paid leave, which is desperately needed. The United States is so out of sync with much of the world on that issue. But, while we're having all of this increased symptomatology, there are many places in the United States, Texas, for example, where the stress, particularly on women, is just being compounded. Women in Texas right now are being tortured. There's really no other adequate way to describe having your body commandeered in the way that women's bodies have been dealt with in Texas. It's torture physically.
You're
it's
talking
mental
about
torture.
their ban on abortion.
Absolutely.
Yeah.
It's women who are already struggling to take care of young children at home, to juggle work and family, are now put in this position where they may be forced to bear children against their will, which not only impacts them, it impacts the children that already may exist in the family. There are many, many studies. We know that having children that are unplanned, it contributes to poverty, not just for the family, but for entire communities. I mean, it's a kind of stress that spreads. So not only do we not really have a national plan to deal with mental stress, in many places, we're making it worse. Yeah.
You also note in your article, this absolutely brilliant article, the COVID-fueled mental health crisis will be caused a second pandemic, that the coronavirus itself is neurotoxic. Explain
That's right. That's right. It is a virus that impacts the brain, and it's not uncommon among viruses. We knew that with the Spanish flu, there was an uptick in psychiatric cases and symptoms, and sometimes symptoms that lasted for years after the initial infection. It's similar to long COVID. So the coronavirus itself can attack the brain. We already are familiar with these symptoms of losing the sense of taste and smell. Well, that's a neurological reaction to the virus. We're also seeing psychotic symptoms. I mean, there have been psychotic symptoms reported in young people, mental health symptoms in people who never had any mental health issues. Depression, chronic fatigue, inability to think clearly. People call that brain fog. So, yes, this is a neurotoxin, and it is especially distressing for people who have those long COVID symptoms. I mean, in some cases, people have not yet recovered from the initial infection that they may have had 2 years ago. So this is all very concerning and is adding fuel to this mental health crisis.
Right, and that could be as many as a third of people who have symptomatic COVID or
Yes.
severely symptomatic COVID, which is shocking.
That's right, and I think that's one reason to be cautious about Omicron. You know, we think, oh, well, maybe it doesn't cause symptoms that are as severe, but we have to remember we don't yet know about long COVID symptoms with this variant, and they very well may be a big problem, just like they've been with the other variants. So that's something
absolutely.
to keep in mind.
And then finally, you note, or I don't, maybe not finally, but you note that the social toxins are spreading. I don't think that, we generally think of things like Trump's lies or Fox News's spin as a social toxin. We might think of it as evil, but not as if it was a disease or a poison. But you can measure the epidemiology of it, just like you could measure the epidemiology of somebody injecting lead or arsenic into the water supply of a city.
That's exactly right. And things like distrust, economic insecurity, a feeling of exploitation, inequality, economic inequality, social inequality, all of these are social toxins that impact mental health and by the same token make us more vulnerable to physical disease. One thing that I really wish we could come to in this country is an understanding that mental health is health. There's no separation between mental health and the rest of the body. If we have mental health symptoms, we're more prone to get heart disease. We're more prone to get cancer. So we need to think holistically about our health and stop this kind of mind-body separation that's, kind of a hangover from the Enlightenment.
Yeah, well, it's also built into our insurance policies. It's built into our laws with regard to things like Medicare and Medicaid and all that sort of thing. You note in the U.S., 10% of insured people make up 70% of the total spending on health care. Of that high-cost group, more than half are seeking treatment for behavioral health. Mental health spending is rising twice as fast as overall medical spending. And that's not just because of the pandemic.
That's right. This is a really sobering thing that came out of the research that I did for this article. Mental health and behavioral health conditions are extremely expensive in terms of healthcare spending. $201 billion is a figure that came out from the National Health Expenditure Accounts in 2016. That was before the pandemic. And just to give you a comparison, that's much more than heart disease. That's much more than cancer. In fact, you could take several of the major, quote unquote, physical diseases, put them together, and you wouldn't get to the spending for mental and behavioral health issues. So, and again, as I said, they're all tied together because the physical ailments contribute to those other, diseases.
So Lynn, as a result of this research that you did and this extensive research you did for this article, what, in summary, and we have a little less than a minute, what do you think as a nation we should be doing differently? Yeah,
we have got to make it the highest priority for our plans for national and global recovery. We really need the Build Back Better Act. I mean, it's not going to solve the problem, but it's going to help alleviate some of the distress with programs related to paid leave and child care, as I mentioned. And we need increased funds for mental health and substance abuse. So we really need to understand, too, that all of this begins with the birth of children. If we do not allow people to care for their infants, and that doesn't mean just mothers, that means all caregivers, and make sure that they have proper preschool care, kindergarten, all the way through, we're creating adults who are going to be susceptible to mental illness. Yeah. So it all begins, it begins from day one.
It begins with family leave.
Yes, absolutely.
Which is in Build Back Better, as I recall.
That's exactly right.
Lynn Parramore, it's over at the Institute for New Economic Thinking. COVID-fueled mental health crisis will be a costly second pandemic. A brilliant article. Lynn, thanks so much for dropping by today.
Thank you very much. Always a pleasure, Tom.
Back at you. Thank you, Lynn. Happy holidays.
You too.
This is the Thom Hartmann Program.
16 minutes past the hour, back with more of the news of the day and your calls right after this. Stick around.